The KDX Compact is an electronic system for recording mandibular excursions. The excursions are shown in a graph for evaluation and the program data displayed for adjusting the articulator. An anterior tray is secured on the lower teeth with fast-setting silicone to record the arbitrary axis. The patient is requested to close the mandible in the reference position, the arbitrary mandibular axis. This is often achieved reliably by asking the patient to smile while closing the mandible. The tray will then align itself automatically with the upper teeth. The ear adapters of the parallel adjustable reference face bow are inserted into the auditory meatuses without exerting pressure, and the bow is tightened at the front with a set screw. The nose piece is then placed on the glabella carefully and also tightened. The neck strap is tightened across the back of the head with a Velcro to hold the face bow in place and prevent the ear adapters exerting pressure on the condyles. The fitting tool is fitted to the mandibular tracing bow to adjust the side arms to the correct distance for the electronic styluses. The 4-wire connector is then slipped onto the tray handle. Both side arms are placed in the arbitrary holes in the tracing plates. The patient is asked to hold this position by hand. The transverse rod is rotated to relieve both side arms and the T-screw tightened to secure the lower tracing plate firmly on the anterior tray. Both side arms are then fixed to the transverse rod with the sure grip screws and both fitting tools removed. The side arms must be held in place securely during this procedure. The electronic tracing sheets are then fixed to the tracing plates. The patient should hold the plug of the left tracing sheet in the left hand and the right plug in the right hand to prevent them from being crossed over while being connected to the electronics box. The electronic styluses are pressed into the sockets in the side arms and screwed into place. The stylus and tracing sheet cables are then plugged together. The cables must be connected to the correct sides of the electronics box. The box is activated with the flip switch on its back. The last registration will be displayed on the screen. It is deleted by pressing the trace key for approximately 3 seconds. 3 short and 1 long beep confirm that it has been deleted. The key is then pressed again briefly to commence the new registration. The trace and tracing sheet distance LEDs flash. The distance between the tracing sheets can be read off the front scale on the face bow. This value is then entered with the plus/minus keys. Pressing the reference point key confirms the distance between the tracing sheets. The reference point and foot switch diodes flash. Completed procedures, in this case the tracing sheet distance, illuminate continually, and running stages flash. The patient's mandible is guided to the reference point, if necessary, helped by asking to smile and close. The position is then stored with a foot switch. The protrusion LED flashes. The patient should be allowed to practice the protrusive excursion by pushing the mandible as far forward as possible, without the teeth touching the tray, and returning it to the reference point. Operating the foot switch records the repeated excursions between the 2 acoustic signals within 4.5 seconds. Once the tracing has been calculated, it is displayed on the screen. If the tracing is to be discarded and repeated, press the protrusion key with your finger. Otherwise, the program simply continues and saves the last recording automatically. The remaining measurements are recorded as follows. The patient must always practice the specific excursions in advance. If a mediotrusive excursion to the right is required, tap the patient's left shoulder. If a mediotrusive excursion to the left is required, tap the right shoulder. The patient can now open the mandible. Once the registration procedure has been completed, the styluses, tracing sheets, electronic tracing sheets, and anterior tray are removed rapidly and in that order to allow the patient to relax. As this registration did not involve recording the position of the condyles, the trace key is pressed briefly to skip this function. This concludes the registration procedure. If a restoration is planned or the model is to be analyzed, a Facebook transfer is carried out immediately using standard procedures. If the position of the condyles is to be recorded with the KDX compact, the entire registration must be carried out with a para-occlusal tray. Thus, the difference between acquired centric relation and centric relation, that is IKP and RKP, can be determined metrically along the XYZ axis. This data provides information on the patient's functional status. The trace key is pressed again to show the data for programming the articulator. The speech and articulator menu is displayed by pressing the plus and minus keys simultaneously. The cursor is navigated with the up and down keys. The options are selected with the plus and minus keys. And invoked by pressing both keys simultaneously. This triggers off the calculation process. They are then displayed on the monitor depending on their complexity. The time required depends on the processor performance. Press the print key to print the registration and adjustment data for forwarding and filing. The GDS software re-records all registered data for long-term electronic storage. This allows evaluations to be repeated, including the time factor and in 3D. The electronic box is connected to the PC and the GDS software activated. Clicking Objects in the menu opens an input mask for entering new patient data. This is then entered with Yes. KDX is opened via the Edit menu. The KDX data input mask appears and the New key clicked to generate the excursions data in the empty table. Double-clicking any spot in the table activates the Data menu item, which opens the KDX Compact Data Input option to initiate communication between the electronic box and the PC. The data transfer process is displayed on the monitor. Click OK to confirm that the data have been transferred completely. After transfer, the data are listed in the table where they can be selected and opened in the form of a moving graph as frequently as required. The bottom toolbar includes a selection for displaying the data registered, for example as a time travel curve. Once the cranium axis relationship has been recorded with the face bow, The facebow can be fitted to the articulator for transferring the upper model directly, or the registration mounted in plaster for transportation using classic methods. This involves removing the joint support and bite fork from the facebow. And sinking them into creamy Artifix plaster slurry on a reference AB stand. Once the plaster key has set, it is placed on the lower member of the articulator in the laboratory. The upper model is placed in the indentations in the bite fork, and the model platform and moistened model coated with soft articulating plaster. The centric lock of the articulator is then locked and the articulator closed to dead center. Once the plaster has set, the centric lock is opened and the model, together with the upper member of the articulator, carefully removed from the indentations dorsocranially to prevent damage to the incisal edges. The bare areas of the articulator and split-hex magnetic plates are degreased with a special cleaner and wiped dry. The upper plate is screwed into place and the split-hex plate placed on it, top to top. The lower plate is then placed on the jig. The centric lock of the articulator must be open. The lower member of the articulator is closed with an eccentric excursion. The incisal guidance pin is at dead center. The width of the lower member of the articulator is marked on the lower plate, the articulator opened. And adhesive applied inside the lines. Spray a thin coat of activator onto the surface of the articulator. Close it immediately. And lock the centric. Place your index finger close to the incisal guidance pin on the lower member and exert gentle pressure for 15 to 30 seconds. Allow the adhesive to set for 10 minutes and remove the split-hex plate. The fabrication of functional and aesthetic full dentures retained by suction requires that a great deal of information and parameters be obtained from the patients. Many schools recommend various procedures which require varying degrees of effort and produce different results. Intraoral bite registration using a Gothic arch system is only one piece of information from an entire chain, that is, the relationship of the mandible to the maxilla, bite registration, which is particularly difficult when the teeth are missing. Dr. Lutz Centrofix makes use of the entire information. It requires certain procedures in the laboratory before and after treatment. We are going to begin with the preparatory procedures in the dental practice with which the technician integrates the Centrofix instruments into the functional tray. The vertical dimensions must be determined prior to impression taking. Traditionally, the dentist placed two marks coinciding with the incisive papilla and lower frenum. This dimension is then recorded with a pair of dividers. There is another physiological method which makes use of the width of the hand between the index and the little fingers. This dimension can also be measured with the Artex meter. The groove is placed beneath the nose and the stop pushed under the chin. The value is then determined and entered onto the patient's record for evaluating at a later date. The assistant needs 2 silicone putty bite blocks for taking a preliminary bite registration. The mandible is then guided to its centric position while monitoring the vertical dimension using the value recorded previously with a dividers or Artex meter. Before the silicone blocks set, ensure that they are in intimate contact with the upper alveolar ridges. This shows the 2 hardened blocks with clear registrations of the alveolar ridges, which will be used later for aligning the models accurately on the articulator. In this case, the anatomical impressions are to be taken in Schreinermacher's perforated metal impression trays, which are pre-formed to fit the anatomy of an edentulous jaw. Both trays are coated with silicone adhesive to ensure that once the silicone is set and the trays are removed from the mouth, the silicone cannot detach from the tray. The jaws are cleaned with gauze and kept dry, while the assistant prepares more blocks to act as stops for the final impression. The stops are placed in the upper tray, posterior region teeth 4 and 7, as well as the palatal vault. The gauze is removed and the tray inserted immediately. The same type of preliminary impression is taken of the mandible, using the same criteria. During the next phase, a preliminary impression is taken of the vestibular fold, for which the tray peripheries are also coated with putty. While this is setting, the vestibule should be massaged and the patient requested to carry out excursions to form the soft tissues clearly. This procedure is also repeated for the mandible. The wash impression is then taken with blue regular viscosity or pink low viscosity material. In both cases, the wash material is applied straight onto the tray with a mixing tip. An extra portion on the mixing pad is applied to the mucosa directly with a brush. During this phase, it is especially important to massage the cheeks vigorously and to ensure that the patient completes excursions of the jaw, as the soft paste takes a particularly detailed impression of the muscular tissue. A ball-end probe is used to palpate the palatal vibrating line, and an impression taken of it using composition. The wash impression of the mandible is taken using the same procedures as shown for the maxilla. While doing so, the floor of the mouth should be activated externally and internally by the patient moving the tongue. This pre-functional anatomical impression is sent to the laboratory, where the model is used for fabricating a custom acrylic functional tray and the central fix registration instruments fitted into it. Both anatomical impressions have arrived in the laboratory from the dental surgery and have been cast. Acrylic special trays are fabricated as usual for taking the functional impressions. The central fix instruments for intraoral Gothic arch bite registration are also fitted during this stage. The following are required for fitting the instruments: Ostron 100 cold curing tray material with accessories, Acrosep alginate separating agent, Combosil kneadable silicone, Vaseline, and a caliper gauge. Coat the cold models with Acrosep separating agent. Dispense the tray material. Coat the upper and lower molding templates with Vaseline. And mix the tray material to a dough. Press the soft material onto the molding template and roll it smooth with the glass rod. Press the flexible tray form onto the model. Adapt the peripheries and cut off the excess material. Allow the material to cure for approximately 7 minutes before cleaning the special tray. Use combisil to build up a support on the lingual aspect of the model for the lower tracing plate. Coat the grub screws with Vaseline. Place the plate on the combisil and level it with the spirit level. Set the caliper gauge to 15.5 millimeters and use it to determine the level of the top edge of the plate, measured from the deepest area of the vestibular fold, adjacent to the labial freedom. Attach the lower tracing plate to the functional tray with Ostron 100. The top surface of the plate must be exposed. Once cured, the entire assembly is removed from the model. To ensure that they can be repositioned properly, loosen the two grub screws and separate the plate from the lower tray. Clean the tray and reposition the tracing plate. The alignment clamp is fixed to the tracing plate with a dorsal hexagonal screw to ensure that the tracing ball holder is positioned in the center and level with the first premolars. Both models are fixed into an Artex fixed grip model holder and placed in the correct intermaxillary relationship using the silicone blocks produced in the surgery. A tracing ball is fitted to the pin holder and a short piece of plastic tube slipped over the protruding section of thread to act as a spacer. The pin holder and tracing ball are then fixed to the alignment clamp and the vertical dimension adjusted with the thread of the tracing ball. Here too, the Allen screws are coated with separator. Mix the tray material to a dough. Place it on the inside of the pin holder and moisten the palatal surface of the upper tray with monomer. Close the upper member of the articulator, invert the articulator and adapt the soft dough to the palate. Once the tray material has cured, loosen the locking screw and open the upper member of the articulator. Release the upper tray from the model and loosen the Allen screws and tracing ball to remove the pin holder from the tray. Remove the spacer tube and clean the tray. Reposition the pin holder, tighten it, and wind the tracing ball in again. The Centrofix intraoral registration instruments are now ready for use in the dental practice and should be checked on the articulated models. The laboratory supplies the special functional trays with Centrofix registration instruments according to Dr. Lüth. The models are released and the impression trays removed from the models. Release the tracing plate from the lower tray. To do so, unwind both grub screws as far as possible, but ensuring that their threads still engage the threads of the metal tracing plate. The tracing ball remains in the upper tray during the entire impression-taking procedure. Coat the entire surface of the functional impression trays with silicone adhesive. Whilst the adhesive is drying, the bite fork must be prepared for the facebow transfer. The upper functional tray is placed in the soft composition to create 3 clear indentations. The periphery of the special tray is coated with regular set silicone from the mixing tip for taking the final functional impression. The extra portion on the mixing pad is applied directly to the palatal mucosa with a brush. The upper tray is placed in the mouth, gripping it with the tracing ball. The cheek sections are pressed intensively to form them. A sucking action should be carried out to form the vestibular musculature. Check the impression, reduce bare areas, and cut off excess material. A new coat of adhesive is added to the reduced areas, pink wash material applied, and a second wash impression taken. Finally, an impression is taken of the palatal vibrating line with composition. Now that the optimum suction has been created between the tray and jaw, it can be used for transferring the cranium-axis relationship to the articulated upper model anatomically correctly. Once the bite fork has been placed precisely, the Artex facebow is used to freeze the cranium axis geometry using standard methods. The lower functional impression is then taken using a similar procedure as for the upper. We would like to remind you that, unlike with the upper tray, the Centrofix tracing plate has been removed. Here too, the preliminary impression is taken with regular set material, and the bare areas reduced and coated with wash material. Again, the floor of the mouth is massaged vigorously from the outside. Here too, the excess impression material is reduced and a wash impression taken of the sublingual space using composition. All excess material has been cleaned off the tray to ensure that the centrofix tracing plate fits the guide groove precisely. The two grub screws are tightened carefully to prevent the plastic thread being stripped. The alignment clamp is removed and the tray placed on the mandible. The universal wrench is used to loosen the tracing ball lock nut on the upper tray and allow the ball to be rotated for adjusting the vertical dimension. The Artex meter or calipers are used for this procedure. Both trays are placed in the mouth. With the ball and plate in contact, the dentist should check the vertical dimension. In this case, it is much too high. In the mouth, the tracing ball is wound in until it meets the requirements. Even without prerequisites, the prosthodontist can evaluate the vertical dimension and adjust it in either direction with the vertically adjustable tracing ball until the patient assumes the physiological position. The tracing ball is tightened with the counter nut. The upper tray must be removed from the mouth and the nut tightened with the universal wrench. The lower tracing plate is then prepared extraorally for the Gothic arch registration. The copper foil is cut to size. A thin coat of silicone adhesive applied to the tracing plate and the copper tracing foil adhered into place. Both trays are then replaced in the mouth. The patient is requested to carry out protrusive and excursive movements with a tracing ball and plate in contact. This procedure should be completed in a relaxed state and can be repeated as frequently and long as required. The lower tray is then removed. The Gothic arch on the foil provides information about the functional symptoms, and in patients without pathologic findings, the tip of the arch denotes the centric relation. The sighting device, which is inserted into the tracing ball holder on the alignment clamp, is then used to align the tip of the arch. The clamp is locked with a large hexagon screw and the sighting device removed. Once the lower tray has been prepared, it is replaced in the mouth together with the upper tray. The patient is requested to close the mouth. If the registration was accurate, the tracing ball will enter the holder in the alignment clamp precisely. Once the jaw relationship has been established, it is locked with a universal wrench. Locking the clamp fixes the tracing ball three-dimensionally. This technique does not require irritating bite registration materials. The aesthetic parameters are transferred with a sheet of soft wax. The wax mask is adapted over the front of the fixed centric registration. The dentist uses a wax knife to mark the lip line, midline, canine line, and smile line. The outcome of the functional impression procedure, that is, the upper and lower impression trays fixed together with a centrofix, is sent to the laboratory. The precise jaw relationship is maintained as the tracing ball is tightened in the alignment clamp. Both trays must be detached from the centrofix registration instruments for casting the models. First, unwind the 2 Allen screws from the pin holder and remove the upper tray. Then loosen the 2 grub screws in the tracing plate and remove it from the lower tray. The jaw relationship is retained as the tracing plate and ball are connected. Dispense the correct plaster powder liquid ratio, shown here being carried out electronically by the SmartBox water powder dispenser. After being stirred by hand, the Giroplast special plaster for full dentures is mixed in vacuum with a SmartMix vacuum mixer. First, small amounts of thin plaster slurry are vibrated into the impression, ensuring that no air bubbles are entrapped. Once the bottom of the model tray has been covered fully, it is filled on the vibrator and the impression placed in it. The same procedure is repeated for the opposing jaw. Once the models have hardened, they are trimmed with a dry trimmer. First, the FaceBow registration is used to transfer the cranium-axis relationship of the maxilla to the articulator. To do so, the incisal guidance pin is set to 0. The SplitX transfer stand and bite fork retained in plaster are positioned on the lower member of the articulator and the upper model located in the indentations. The dry surface of the model is moistened and a thin mix of Artifix articulating plaster spread on both sides of the counterplate and on the top of the model. The articulator is closed and the tension in the plaster slurry released by tapping the top of the articulator with your fingers. The incisal guidance pin now contacts the incisal table, but without exerting pressure. During the first 3 minutes of the setting process, the excess plaster can be wiped off effortlessly. Once the plaster has set for approximately 4 minutes, the articulator can be opened. First, the centric lock is opened to allow the model to be released dorsally from the indentations in the bite fork. Then the articulator is locked again. The SplitX transfer stand is removed. The tracing plate of the central fix registration is then screwed to the lower model. And the pin holder to the upper model. The jaws are now in the correct centric relationship. The incisal pin is then removed, the articulator inverted and opened. The counterplate is placed on the split-X magnetic plate and the articulator closed to check the space available. The lower model is then articulated using Artifix articulating plaster as described previously. Here too, the bottom of the articulator is tapped gently to release the tension in the plaster slurry, and the anterior guidance pin placed in contact with the incisal table. After hardening, the tracing ball of the centrofix registration is released and the centric lock of the articulator opened to allow the ball to release smoothly from the pin holder when the articulator is opened. The functional trays are removed from the models, which now coincide exactly with the physiological status of the patient. That is, the cranium axis and jaw relationships, as well as the vertical dimension. This provides the dental technician with optimum conditions for fabricating perfectly functioning dentures.